Good morning. Thank you for joining me today. This is a really exciting day because I am going to be interviewing Dr. Carissa Marsh. She has been a friend of mine for over 10 years now, I think, and super, super smart woman, worked in the schools for years, and now has her own private practice. I'm going to tell you a little bit about her before we bring her in. But the point of today is going to explain what a psychologist or a clinical psychologist does and what a school psychologist does. So if you ever want to have testing done for your child, this will be a great thing to watch so you know what to expect and what to ask. So she's been practicing over 10 years with a degree in educational psychology with a specialty in school psychology. She worked in the public schools, then a large practice, a group practice, and now she has her own business. She's an entrepreneur, which is really cool. She has one daughter and 3 cats. And right now she says her life as a purpose is about building empathy and understanding to others. So she's an amazing person to work with. And if you're in Jacksonville, North Carolina, she might be the person you want to check in with. Her name of her company is called Insight Psychological. And you can always DM me if you want her information. And I'll probably just link it below after we're done talking. All right. So I'm going to go ahead and bring her in. And her title for today, she wanted to talk about was, she always feels like people think they're analyzing. She's analyzing them. So she's going to talk about that too. All right, here we go to invite Miss Dr. Carissa Marsh. All right. Hello.
Hi.
All right, so this is Dr. Marsh, everyone, and she is here with us today to talk about what she does and what a psychologist, school psychologist, clinical psychologist, whatever type of psychologist you see, she's going to talk to us about that.
Yes. Should I start with what a school psychologist is?
Perfect. That'd be great. Yeah. What is a school psychologist? That'd be a great one.
So school psychologists generally work in schools, and depending on where you live, they can have a lot of different things that they do. They can be involved in like some counseling. They can be involved in helping with helping teachers get behaviors under control in their class. They can also help with academic interventions. Around here in North Carolina, in our county at least, we were mostly just doing special education evaluations. So when a parent or a teacher had a concern about if a student was having a hard time learning, and they were trying to figure out, well, maybe we should be giving the students some specialized instruction through an IEP, individualized education program, then the school psychologist is part of that process and does some assessments and observations and gets information from a bunch of different people to bring to the team to help make that decision about if this student needs special education.
Oh, wow. So would a parent, like, if they were at a school, would they look a school psychologist up, contact them, and then schedule testing? How does it work? How would they get a hold of you, or how does that process work?
Yeah, there's a lot of different ways to kind of start this process. Sometimes a teacher will kind of start it, and let's see, I haven't worked in the schools here for quite a few years, so things might be a little different because things kind of change every year. But there should be some kind of process for putting interventions in place first, whether it be like behavioral interventions or academic interventions. And especially coming out of COVID, that intervention process is really key because so many kids lost kind of a good chunk of academic instruction during that time across the board. And if we can get kids back on track just with some really intense intervention, then that's awesome, right? But if those interventions are still not really doing what they should do, maybe that student is not kind of, learning at a good rate, then that suggests maybe special education is in order. So sometimes a teacher will initiate that process. Sometimes a parent can be like, hey, I think this is not going well.
Mhm.
So usually the first thing a parent would do would be to talk to the teacher. But sometimes parents aren't really pleased with how that conversation goes. And so then you can try different avenues. You can talk to the guidance counselor, or you could talk to the principal, or I if a parent is having a hard time with maybe several different people in the school, like trying to get maybe their needs across in a way that the school people would understand, um, then I would say, try getting it up with the school psychologist, because the school psychologist is often the person in the school that has the most knowledge about special education law and what we need to be doing to help students be successful.
Oh, good. Interesting. Okay. That's great to know. And so you were talking about interventions. Are those interventions typically done in the classroom, or is that thing something a parent would keep track of? What do you mean by an intervention?
So this is really going to vary from school to school, county to county, state to state. This is going to be really diverse how it happens. A lot of times it's kind of like you start in the classroom and seeing if there's some different things that the teacher can be doing in the classroom to help the student be successful. And if that's not working, or maybe the teacher has already like tried a few things to individualize that student's learning, then maybe it might move to like a small group situation. So like a lot of times kids will be in like a different reading group or something like that. Um, and if that's not working, then usually you would be looking at something a little bit more one-on-one, um, for like behavior difficulties. If a kid is having a hard time kind of regulating emotions in the classroom or regulating their behavior, a popular intervention is a check-in, check-out program. So that would be, you have goals that a student would be trying, a few goals the student's trying to reach. Let's say they're trying to raise their hand more instead of just calling out, or maybe they are, maybe their goal would be to voice their feeling instead of just melting down, those kinds of goals. And then you would have a person that they feel a connection to, that they check in with in the mornings. You review the goals. That person, kind of does a pep talk. And then throughout the day, the teacher is giving them feedback on their goals. And then at the end of the day, they check out with that same person that they checked in with, so that they can kind of review the day, hopefully praise the kid. If there was some issues, they kind of problem solve that kind of thing.
Oh, good. Okay. And so say a parent has done all of these things and then they're frustrated and it's not working. And then they don't know what to do. So what would you recommend? They've reached out, it's been hard for them. What would your recommendation be?
All right. So if they've tried the school psychologist and they still are, here's a common scenario. Parent sees this difficulty that's happening with their child. The school is like, their grades are fine. That's a common scenario. And a parent is like, yeah, but you don't know how hard we're working at home to keep those good grades, or, something like that. And you've talked with teacher, you've talked with principal, you've talked with school psychologist. You keep moving up the chain is my first recommendation. So you figure out where your county special education department is, or find their number on the website, and you speak with county level. Around here in Onslow County, it's called Exceptional Children's Department. It's called other things, other places. Let's say you still are having a hard time, then you can contact your Department of Public Instruction, DPI. I don't know if it's called that everywhere or not, but you can speak to, I think they call them like usually like mediators or something like that. You can go to the state level to just get some help in this process. So a lot of times DPI will have someone that can come attend the meeting, and they're kind of mediating between parent and school. Another thing you can do is you can find like a special education advocate. Some people, there's like people that have that as a business, right? And, you know, kind of, I'd say worst case scenario is that you work with a lawyer.
Yeah.
But that would be, you know.
Extreme.
Yeah.
And so say they decide that they're just frustrated and they want to just move forward on their own, and they would then reach out in the community and maybe find someone like you. How does that work? So how would they find someone like you? What would they start Googling, or how does it work if they just decide to do it on their own, if they want to find a?
Yeah. So there's a couple things you can do. You can talk with your pediatrician and talk with them about your concerns. And you can say, look, I think that my child is having a hard time regulating their emotions. I don't know if it's because they have ADHD. I don't know if it's because they're really anxious, you know, all these different things. And I would like to figure out more about what's going on. Then the pediatrician could refer them to a psychologist like me. And when there's things going on, mental health wise, insurance will often at least cover some of that cost. If it's just education, like if a parent is like, I think my child has dyslexia, insurance doesn't normally cover that. They say, you know, schools can handle that. Insurance is for medical things, right? Mental health / medical things. You can Google yourself, you know, Google a psychologist. You can Google like psychological evaluations or dyslexia evaluations, you know, like, I don't know. You can usually find something like that. Let's see. Something to keep in mind is that when you do an evaluation, you know, in the community, so like when I'm doing an evaluation, let's say I'm like, yeah, I see a lot of evidence here that the student has maybe weaknesses in understanding the sounds and letters and how they all go together, which is a sign of dyslexia. If I say that, it's not like the school is automatically going to be like, okay, now we have to do special education because Dr. Marsh said, you know, unfortunately, it doesn't work like that. The school will use my information as just another piece of information to inform the decision. So they could still say, we really don't think the student needs special education.
Okay. So they could take your testing results to the school and it would just be another document that would support, and the school would just have to decide how they were going to use it.
Yes. Something that, another thing for parents to keep in mind when they're trying to advocate for their child is the big question for deciding if a student needs specialized education. Well, there's two big questions. Is there an educational impact of whatever diagnosis they might have. And do they need specialized instruction? So those are the two big questions that they ask at the eligibility meeting. And sometimes people think it's just grades. Educational impact is just grades, but that's not the way that you should interpret that question. Let's say your child is getting sent home a lot, or is disrupting other kids in the class like all the time. That is also educational impact.
Yeah, definitely. And so a goal then would be for them to use those results from what you said and explain that to the parent, explain that to the team.
Yeah. Mm-hmm.
Okay. What other reasons would someone come to you in the community to help their child?
Sure. So apart from functioning at school, some kids, they're fine at school, right? But they're just having a hard time at home, or just parents are like, I don't know, something seems a little different with my child, and I'm really just trying to figure out more about how their brain works. Then they might come to me. Yeah, maybe there's different things that might impact at home, like if a child has separation anxiety. Well, that would sometimes impact school, but sometimes there's other things at home that would be a little bit like, okay, it's impacting how we're functioning as a family, or maybe like mom can't go about her daily life because of this child that cannot be away from her. That would be a reason maybe to come to see me.
Okay.
Or maybe they're having a hard time like getting their chores done every day, or things like that. And the parent has tried different scenarios, or they've worked with maybe a therapist and they've tried to figure these things out and it's still not working. And they're like, you just got to figure out what's going on with this kid's brain. Then
Yeah.
hopefully I would be able to give a little bit of insight into how their brain might be working.
Okay, that's really good. Okay. What other things would you recommend for a parent that might be struggling with their child, and what they should do? What other
Yeah.
recommendations?
Um, I don't know if you use this a lot. You probably do, but trying to understand what's going on with the child.
Mhm.
If you think about when, let's say you're having a bad day, you tend to be a little bit more snappy, maybe, or maybe you just get really withdrawn, um, or other things. What do you like when you're hungry? What do you like when you're tired? You can think about all these different things and try to put yourself in their shoes, and remembering that things that you think aren't a big deal for a child, it might be the end of the world.
Mhm. Yeah.
And it's very hard for adults to pick out, why am I acting like this? Why am I feeling like this? It's even harder for kids
Mhm.
if they don't have the language. So that's my kind of first thing would be, building that understanding and trying to put yourself in their shoes. And first, just supporting your child, trying to figure out, okay, how can I make your day a little bit better? Right? Um, let's see. Other things is I love using books with kids,
Mhm.
and I have some books that I've kind of discovered over the years. There's this really cool series called A Kid's Book About, and they just have, I think they've got like tons of them now. They just keep coming out with them. But like this is an example, A Kid's Book About Failure. And so these books are designed for parents to read with their kids. And it's kind of like a way to talk about kind of either really heavy subjects or tricky subjects, things like that. So
Are there
like,
pictures?
here's a page. Here's a page. Like it has just kind of like
The anger.
Anyway, so that's a series that I really like. The American Psychological Association has a publishing branch for kids books, and that's a good place to look for, so that maybe, okay, at least someone has looked at these books and said that they seem to be good quality. But they have a series called What to Do When. So like this is an example.
Yes.
That for kids that are maybe autistic or having a hard time kind of labeling emotions, recognizing when they're getting angry or things like that. This is a very well-known system. All right, incredible 5-point scale. I'm inundating you. Hopefully this is okay.
We're gonna link, we'll put all the books, we'll link them all below in a PDF so people can see them.
Yeah, that'd be good. Breathe Like a Bear. Have you seen that one, Anastasia?
I haven't.
It's super cute. It has all these mindfulness. So this one is hot chocolate, and it's like how, so you're like, getting your hands warm and then you're breathing in the hot chocolate. Anyway, it's really
That's cool.
Yeah.
I love breathing stuff, I suppose.
This is one I just got. Wiggles, Stomps and Squeezes Calm My Jitters Down. So it's trying to, this one I think is not only helping kids kind of be like, hey, yeah, that's me. It's also helping parents maybe be like, oh, okay, that's why they need to run around in a circle for a little while.
That was good, yeah.
This is another one, My Whirling Twirling Motor. So it's kind of talking about ADHD, and this one is cool because it shows kind of how the kid feels bad throughout the day for, they get reprimanded for different things, and then at the end of the book is like it's bedtime and the mom is going over like things that she loves about the kids. So that's neat.
That is good, yeah.
And then a big one is when kids are having a hard time learning to read. And this is an author that my mom actually recommended to me. Her system is called Logic of English. She has really nice, it's all, research-based instruction ideas. And she has this really cute book, How Your Brain Learns to Read. And that can help because, how many of us really know how to do, we don't know how to teach reading, and so it helps us also understand all those systems in your brain. And then she's got really cute books for learning the different sounds. So like, it has all the different sounds an A can make.
Oh, very nice.
Anyway, so that's kind of a rundown of books. I love using books for kind of building that understanding, and
I do too. And I think the books, even if they're child books, they help the adults just as much as they do.
Absolutely. I have the What to Do When books. I've shared them with some adults. I've been like, I know this is a kid's book,
Yeah,
but it's really, it's nicely laid out, easy to understand.
Yeah, I love that kind of stuff. Well, thank you so much for sharing that. Is there anything else you can think of that we should be sharing with parents about a psychologist?
Not all psychologists do psych testing. So that would be something when you're kind of Googling, looking at people's websites, see if they mention psych testing.
Okay.
Let's see. You know, you should be asking questions when you're trying to figure out, is this going to be a good fit for doing the testing? Just like for therapy, you want to be finding a good fit for your child and the questions that you have or trying to work on. You know, hopefully you wouldn't be going to somebody that has never seen a 3-year-old if you are having a hard time, right? So it's kind of same thing with psych testing. You want to look for somebody that has experience working with kids, because it's a very different skill set than testing adults. If you are looking at maybe some more complicated questions, like does my child have autism, or does my child have OCD? You know, like you want to ask, you know, do you have experience in these things?
That's good.
Yeah.
That is really good. Knowing who you're working with is really, really important. Making sure they have the experience. I agree. I'm glad you brought that up.
Yeah.
Because sometimes people are so desperate, they just go to whoever, they don't do the research part to find, because they're just struggling. And so I think knowing that I need to make sure I have these questions to ask before is really helpful. So thank you for telling us that.
Yeah.
Cool. Well, thank you so much for meeting with me today.
Of course.
If anyone has any questions from you, could they contact you?
Sure. Yeah. I don't think I have my email address on my website, but you can give me a call.
Oh, great. Okay. I'll put your website down below so they can see your stuff. And then we'll link all the books that you have so people can look for those. And if anybody has a question for me, feel free to DM me. And yeah, I guess that's it.
Okay.
Thank you so much. We'll see you
You're
soon.
welcome. Okay. Bye.